Alecia, thank you so much for your time. Can you paint the picture of how bad it really is for expecting mothers in rural Australia right now?
Yeah, as you mentioned, a lot are having to relocate for birth. Unfortunately, some of them just can't, whether they're farming communities and have farming to do. You know, it's not just possible to leave crops standing that need harvesting and things like that. But we also know some of these families have kids in school, you know, parents working. Like it's a huge burden. I guess the other side of it is some that are just either staying put and free birthing or running the gauntlet when they're in labour. And we have seen a 200% increase in born before arrival, so roadside births. And I've seen the photos of women who have birthed their baby and the placenta in the gravel on the side of the road. You know, mostly these are good outcomes, but there are instances where it hasn't delivered good outcomes for women or perhaps their babies in these circumstances.
Now, you've been pushing for there to be a Medicare item number to get the assistance of a midwife in the circumstances of rural birth. Now, how would that make a difference to the challenges that people are facing?
Well, currently we don't have any birth options, or in a lot of settings not even antenatal and postnatal care. So I would assume that, you know, we should have the state government lobbying for this, because Medicare doesn't cost them money. It's federal money. So there are Medicare items sitting there. I guess our biggest thing is they're not going to reimburse the midwife for her time. So we're trying to get some bolstering around that, because it's still going to be cheaper than what the federal government is funding the states at the moment, because they provide about 60% of the funding for maternity services. We're also trying to get Medicare for home birth. That has been an issue for years. We know that for some of these women, they are happy to birth at home, but at the very minimum, they should be able to access antenatal and postnatal care. And a very real, like, simple solution for governments, state governments, is actually to go back to the federal government and say, let's increase these rebates for private midwifery care. Let's look at what are the barriers, and they're only very small tweaks that need to happen to get more midwives into private practice. You know, then they travel to women, and that is an ideal model, and it has had and continues to have amazing outcomes.
Now, it was looking like this proposal, which seems to me to be very practical and not overly financially burdensome, would get over the line. The department seemed like it was receptive. What seems to have changed?
We were actually hoping to have something in the recent budget. Unfortunately, it didn't get over the line. I'm not sure how you would continue to overlook the data. You know, reducing the preterm birth rate of Aboriginal babies. We know the stillbirth rate is reduced when we have these types of models, so a known midwife. We know from the data of private midwifery, the caesarean rate is between 5 and 20%. Our national average is 37%. Now, that's even including those women who elect to have caesareans. So it is actually a fiscally responsible model, and it works out a lot cheaper, because whilst it is a short-term investment, if we're looking at the longer term, it's a lot better off. I am not exactly sure, but we are extremely disappointed. It seems very short-sighted and actually not really looking for solutions, despite even the recent inquiry into reproductive health care that did recommend getting the rest of these Medicare recommendations for private midwives through, that everything's really sitting idle. And whether it's department, which I probably am intending to lean towards, but at the same time, that's where ministerial involvement is needed to give directive to these stuff to get it sorted.
Well, Alecia Staines, don't give up the fight, because the closure of these maternity services is unconscionable, and to not provide another way to keep these women and babies safe is just so wrong in a modern society. Keep up the great work, and thank you for your time tonight.